Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, our Provincial Health Officer, doing our daily briefing on COVID-19 here in British Columbia. I wanted to first acknowledge that we're doing this on the territories of the Musqueam, the Squamish, the Tsleil-Waututh First Nations, and I wanted to introduce Dr. Henry.
Thank you. Good afternoon. So for today's update, there's a couple of things we want to do. First, to give you the new cases and the new totals that we have in the province. And then we're going to talk a little bit about what this means and some of the data that we're using to drive and to understand what's happening in our community. So to start with, we have 74 new test positive cases today, giving us a total of 424 people in our province who have tested positive for this disease. That is 230 in Vancouver Coastal Health, 126 in Fraser Health, 37 on Vancouver Island, 27 in Interior Health, and we remain at 4 people in Northern Health. In addition, we have had 5 new cases admitted to hospital for a total of 27, and of those, 12 people are in ICU, and 6 have recovered. We have 1 additional death related to the Lynn Valley Care Centre, bringing our total to 10. On a positive note, we've had the person who was hospitalized at one of our long-term care homes is now out of hospital, which is good news. And we have a number of increases in staff, increased by 1 in the residents and staff at Lynn Valley Care Centre who have tested positive. I think this tells us again that we have risk around the province and how important it is for us to pay attention to what's happening in our community and take those measures that we have been talking about all along. So this is not only confined to hospitals, to our healthcare sector, it's also in our communities, and the actions that we are taking today make a difference in how we can transfer this disease to others. As well, I am issuing a new order today. Effective today, I am now ordering that personal service establishments must close until further notice, as these require direct personal contact with other people, and that is impossible to deliver while maintaining appropriate distance. So these are things like salons, spas, massage parlors, tattoo shops, etc. And I know most of these businesses have closed, but it's come to my attention that there is still confusion out there about whether they should be open or not. So we want to make it very clear that the expectation is that these will be closed. So I'm going to give us a little bit of a look, if we can put up the slide. We've talked quite a bit about what we do in public health and about epidemiology. And epidemiology is the study of the who, what, where, and when of diseases, and it's about tracking the disease and helping us understand what's going on with it. So we track 2 curves. And what we have been talking about here, for the most part, is the number of people who have tested positive on a given day. So the numbers that I gave out today, for example, were the positive tests that came out of our lab over the last 24 hours. And so that is this curve here. I guess I need to, okay. It's about tracking the disease and helping us understand. If we look at what has happened since the beginning of January, and the 15th of January, we had our first case. The dark blue represents the cases plotted on what we call an epicurve by their onset of illness. So there's 2 things that we're looking at. What you are receiving every day, what we have been giving out, is the number of people who test positive. Those people are people who have been identified by public health as having a risk, having an exposure. They get a test. Sometimes it takes several days before that happens. So when somebody gets sick, there'll be some time before they recognize it sometimes, and that's one of the challenges that we've had with this disease, that people may go to work, may interact with others before they realize they're sick. At some point, they realize they're sick. They may see their healthcare provider. They may go to one of our assessment centers now, and they get a test. And it takes sometimes several days for those tests to come back. In the meantime, public health is doing their investigation, the detailed investigation. And as we talked about from the beginning of this, we did very detailed investigations on all of our initial cases where people who were imported from other places. And we find out when people's symptoms start, because that helps us understand where their exposure might be. And with this disease, we know the incubation period is up to 14 days. So we meticulously track everywhere that they had been in those 14 days and determine if there are other people that were exposed, and we keep those people in isolation to see if they develop symptoms, so that if and when they develop symptoms, they're not passing it on to others. So the curves that we're watching very carefully are the dark blue. And this is our epi curve by onset of illness. And this is the one that we will start to see decrease if all of the measures that we're taking are effective. So when we talk about flattening the curve, it's not necessarily the tests per day that is important. It's the number of people getting infected and making sure that we can look back at those days ahead and isolate people before they can transmit it to others. So this affects, this is why we have put in some of these drastic measures that we've been talking about around social distancing. The social distancing, the physical distancing from people is what helps us not transmit this infection between us. And this is incredibly important right now for everybody. We know that we've had community cases for a couple of weeks now. We know that people in the community are transmitting it to each other, and that is leading to the outbreaks that we've been seeing in long-term care homes, in hospitals. It means that healthcare workers are getting infected. They're getting infected in the community and then bringing it into work in some cases, or transmitting it between each other and between their families. These are important things that we can affect now. I think, all right, we'll go to one other. I also wanted to give you an idea of what we've been following in terms of the ages of people who are affected here in British Columbia. And what we have in the dark lines are the proportion in our population that are in that age group. And what we have in the lighter lines are the number of people that have tested positive for this disease. And as you can see, there's more people in the older age group. We have very few people in the age 10 to 19, so young people. We have nobody under the age of 10 at the moment. We've been following in terms of the ages of people who are. We have a cluster, a group of people in their 30s to 40s, and that mostly reflects healthcare workers who are involved with our clusters. It also represents up to 20 people now that have been associated with the dental conference that happened a few weeks ago here in BC. So those tend to be younger, healthier people. But we also have a skew to the older people. And again, that represents the severity of this disease in older people and the outbreaks that we're seeing in our long-term care homes. So we will be posting this information on a regular basis over the next coming weeks so that you can have a look at this as well and understand how we're doing at making that epidemic curve flatten out and lengthen out so that we're best able to take care of everybody in our healthcare system. This is our chance to alter the course of this epidemic, and we can do it. We have seen that it is effective in other countries if we all do our part. It's in our hands right now. So this is our chance to stay apart, to connect socially, to connect virtually, to support each other, but to physically distance. And I'm calling on all of you to do that right now.
Thank you very much, Dr. Henry. And Dr. Henry has noted that we have 74 additional cases today. And just to put it in context of some of the discussion we've had about acute care beds in the last few days, that represents 27 people in acute care. 12 people in ICU, which is an increase of 2 since we last reported. And we also, as Dr. Henry has said, are reporting an additional death today associated with the Lynn Valley Care Home, and our hearts go out to the family and to the people at Lynn Valley for their loss. I wanted to update you on a few brief facts. In the coming week, we'll be updating more regularly the number of tests. We've been updating it every Friday, as you know, up to now. We'll be updating that more regularly. That will happen on the BC CDC website starting sometime early next week, and so that will give a sense, because I think some people, by the time we get around to Thursday, look at those numbers and say, well, that's not enough. So we want to make sure people are up to date on that. I want to do a special call out to people who have been in touch with 811 nurses and staff in the last day. And they're very proud of the extraordinary work they do, more than 3,000 calls. I just want you to know that in addition to previous additions, we added 7 nurses as of yesterday and 30 patient navigators to the 811 service as of yesterday. We also had a record day with the patient self-assessment tool yesterday, with more than well over 530,000 calls, which was a record day for us on that, and approximately 1,800 people contacted the COVID-19 line. I wanted to note the news release from Vancouver Coastal Health about all of the measures and additional protections that are happening in long-term care, which will be mirrored by similar releases in Fraser Health and Island Health today. And just to finish off, because we want to focus today on what Dr. Henry has said about the progress of the pandemic here in British Columbia, that just a few points. That there's a lot of discussion. And I know there's some anxiety about the measures that have been taken, the very strong measures that have been taken here in British Columbia. And I think what I said yesterday and what Dr. Henry has said consistently is that they require 100% compliance. We need everyone to comply. Most of these measures are orders. They're also enforceable orders. They're orders of the provincial health officer. It is, and so if you've traveled internationally, you have to stay home for 14 days. You have to stay home for 14 days. That is your obligation, your responsibility to your loved ones and to the community. It's also an order. The no bars, no restaurants except for takeout, as Dr. Henry said in personal services industry, large gatherings, those are all orders. They're the obligation of people not to do those things. They're also orders, and they must not happen. As you know, many municipalities have closed down recreational facilities and many other things. Those have happened, and they're significant, and they reflect what's happened in other jurisdictions. School classes have been canceled, both at the K-12 level and at the post-secondary level. Those have happened. And so I want to say that, again, that it's everyone's obligation to comply. And the most important thing, the thing we've been saying here at every briefing since January, that if you're sick, stay home. If you're sick, stay home. And that is, I think, a key a key responsibility that everyone has to deal with the spread of COVID-19. There may be questions, and we look forward to questions in comparison with other jurisdictions, but these are essentially what people are doing everywhere. And we'd be happy to discuss that in the question period. This is really, for all of us, as individuals and as a society, the greatest fight of our time. Our response so far has been good, and it's been human. But it needs to be more than that. It needs to be 100%. It isn't about somewhere else. It isn't about somebody else. It's about you. It's about me. It's about all of us. And that's why it's essential. That's why we need from everyone 100% participation, 100% effort, and 100% compliance with what Dr. Henry has asked. These are tough measures, but tough measures are as tough as our commitment, 100% of us, to follow them. Thank you very much. We look forward to taking your questions.
Thank you, Minister. And before we
En
take...
français, excusez-moi. Dr. Henry me me rappelle qu'il faut le faire brièvement en français, si vous voulez. Nous annonçons aujourd'hui 76 nouveaux cas de COVID-19 en Colombie-Britannique pour un total de 424 dans la province. Nous annonçons également, avec grande tristesse, que notre résident de Lynn Valley, qui a été testé positif au COVID-19, est décédé. Nous offrons nos sincères condoléances à leurs proches et au personnel qui a pris soin d'eux. Chaque régie de santé en Colombie-Britannique compte des patients atteints de COVID-19. 230 à Vancouver Coastal, 126 à Fraser, 37 sur l'île de Vancouver, 27 à l'intérieur et toujours 4 au nord. De plus, sur le total des cas de COVID-19, 27 personnes sont actuellement hospitalisées, dont 12 sont en soins intensifs. 6 personnes se sont rétablies et les autres patients sont à la maison isolés. À compter d'aujourd'hui, les établissements de services personnels doivent fermer jusqu'à un nouvel ordre, car ces services nécessitent un contact personnel direct avec d'autres personnes, et cela est impossible à fournir tout en maintenant une distance appropriée. We're happy to take your questions.
Thank you, Minister. And before we take questions, a gentle reminder, the media on the phone can be unmuted. You will not be audible till your name is called out. To queue up for asking questions, please do dial *1. And again, a gentle reminder, please do ask only one question. We will begin with James Keller, followed by Keith Baldry and Srishti Gangdev. James, go ahead, please. James Keller?
Hello?
Yes, go ahead, please.
Oh, great. So to, I guess, both Minister Dix and Dr. Henry, you described social distancing measures, including self-isolation, as orders, and you say they're enforceable. So is BC going to be using fines or other penalties for enforcement of these requirements, and how do you intend to enforce that?
We can, if needed, yes, and we have provisions to be able to work with peace officers around the province to assist us in that.
Thank you. Next question, Keith Baldry, go ahead. Keith?
Hello?
Yes, go ahead, please.
Yeah, sorry, Dr. Henry, what's your response to this letter written to you by the physicians at Royal Columbian Hospital asking for much stricter containment measures, essentially a lockdown?
Yeah, so we've talked about that, and we've talked about the measures that we're doing, and I absolutely agree with them that we need to make sure that we're doing everything we can. And the term lockdown is a nice one to hear, but I think, I believe that the measures that we're doing equate to what they are asking. There are still some problems, and there's still some concerns, and we are being made aware of those, particularly groups of young people. Young people feel that they're immune to this, and if we look at our epidemiologic curve, people are not immune. And not only that, but then you bring it home to your home, your family who might be healthcare workers, the elders and seniors in your family. So this is what we're talking about in terms of making sure that we're not gathering on the beach to watch the sunset, that we're not playing basketball, that we're not gathering together on the playgrounds and having play dates. We need to do that now, physically distant. It is important for people to get outside, but do it with your family. Do it with the people that you live with, and maintain distance from others. That's really important. That's the types of things that we're seeing in places where it's called a lockdown. Having said that, we do need to make sure that our essential services continue. We need to be able to get groceries, to get medications, to get the hardware we need if we have a burst water tank, things like that. We have to make sure that we do that in the safest way possible. And I absolutely agree with them. We need to take some more measures to help people understand that those groups are not, you can't do that right now. You need to do that online, not in person.
I think it's important to be clear when you compare, people discussed other jurisdictions and the language that they used. In California, there are 16 sectors, not industries, not groups of workers, 16 sectors that are exempted because we have to, they have to operate their society and their economy, and that means getting all of the things in place for all the essential workers, healthcare workers and others, to function. So when we talk about 100% in that case, that's 16 major sectors there. And in California, people can go outside, but like here, they have to maintain social distance. So I think there's what we don't want to do, and what we've tried to do is be very practical and direct and strong here. I think Dr. Henry's orders are very strong, and what we need to happen is for them to be enforced. And certainly the views that are expressed by doctors in Fraser Health and lots of other people who are in touch with Dr. Henry and myself and others all the time, well, we share those views. And we understand that this is the period to flatten the curve and that it's everybody's responsibility to do that. And that means, especially on the key issues of staying home when you're sick, staying home when you're returning from vacation, maintaining distance, that these have to be enforced. And, of course, all of the specific orders that Dr. Henry has laid out over the last number of days. So people are saying, is this tough? You bet it's tough. But it's not just a question of sounding tough. It's a question of ensuring that everyone understands that it is their responsibility to participate.
Thank you. Srushti Gangdev, go ahead, please.
Dr. Henry, Minister Dix, the Northwest Territories has reported their first case. We've heard in the past couple of days, all three territories have already declared states of emergency. They are concerned about what will happen if they have outbreaks. If, for instance, Yukon reports cases, is BC going to extend any kind of support infrastructure to help them with that?
Absolutely, and we do all of the testing so far for the Yukon, for example, is done at the BC CDC lab. So we are in daily contact with them around other things. My counterparts in the Yukon, I connect with very closely. I know they're very concerned, as we all are, as we are in our northern communities and our more remote communities and our First Nations communities that we share. Yes, we're working very closely with them, and it also reflects the importance of us not traveling and not going to remote communities, particularly if we've been out of the country, particularly if we're not feeling well ourselves or we've been exposed to this virus. And our communities, we know, across BC, particularly in the Lower Mainland, now we're seeing increases on Vancouver Island and in the interior. It's our duty to stay close to home right now to protect those who are more vulnerable to this and who have challenges in dealing with this. But definitely it's our concern that it get into some of the communities in the north, and we need to do everything we can to support them as well.
Thank you. The next questions will be from Ashley, Alana, and Matt. Ashley, go ahead, please.
Hi, Dr. Bonnie Henry. Just to what you were just saying right there, as the number of cases increase nationwide and some people here in BC may be needing to go to other provinces to, say, help with family matters or other things, should people at this point be concerned about the possibility of a ban on interprovincial air travel? Is that something you guys are considering at this point?
We have had discussions, of course, nationally about how do we best do that. The reality is we are all interconnected. And as you say, we have family, we have urgent issues, we share healthcare resources in some cases, but we also share, those essential lines of services, like being able to deliver food, being able to get resources that we need to keep things moving all around us. So I think what we have been discussing is much more around being very cautious about travel, making sure we have health checks for people, that you're self-monitoring carefully, that if you do go to other communities, that you take those same precautions that you're taking here, which is only go to the places that you need to go with your family. Social distancing is being practiced across the board in this country, whether you're here or in Saskatoon or in Whitehorse. So those are the things that we need to do. We recognize that people do have to take care of urgent family and other concerns across the country, and I don't expect that we'll be able to stop that. We're just too dependent on each other for many things. But now's the time to do your best to stay home.
Thank you. Next question is from Alana. Alana, go ahead, please.
Hi, Mr. Dix and Dr. Henry. I just wanted to touch on the Pacific Dental Conference briefly. Now that there's 20 cases at least there in Vancouver, and there's also some here in Alberta, I just wanted to know what kind of measures are being taken to track attendees of the Pacific Dental Conference, if any.
Yeah, so the 2 weeks from the dental conference actually expires soon. So it was, or I think it's today or tomorrow. So what we did was notify every single attendee of the conference that there was cases associated with it and that they needed to go into self-isolation immediately. That was an order that I gave for all the attendees here in British Columbia. And I know my counterparts across the provinces have been doing a very similar thing. And that's certainly why people have come to light, which is good. You know, people that have been identified, as I mentioned, there are 20 here in British Columbia now, were identified because we gave that notice out and they isolated themselves before they for the most part, before they got sick themselves. So that is the good news. The challenging thing is this was an international conference, and it's very likely that there were people who were sick who came from other places and passed it on during that conference. But it is a reflection of how these mass gatherings, if you have, you know, we call it super spreader events perhaps, where you have one person who may be somebody who's shedding a lot of virus, or one or two people who may be shedding a lot of virus who are passing it on to many, many others. And it's an unfortunate thing that happened. You know, I wish it didn't, but we can't go back and change that. So the notification was the most important thing, and we did that as soon as we recognized that that this was more than just one person. Yeah, so it is a challenging thing. I know there are cases in other provinces as well.
Thank you. Matt, go ahead. Matt, are you there? Well, the next two questions will be from CTV and Fairchild. Ben, CTV, go ahead, please.
That today from doctors within Fraser Health expresses very similar concerns to what we've been hearing from people unwilling to go on the record that work on the front lines in Fraser Health over the past few days, saying that they are afraid for their personal safety, for their family's safety, because they don't have enough personal protective equipment. There are shortages of staff. They say the measures put in place for the general public are not sufficient. They want to see social interaction face-to-face limited to people within the same household. Will you give that kind of directive using that language today? And if so, how will you enforce this? Because the doctors have not been willing to go on the record now, but they will be on camera today, and they are frightened.
Yeah, and you know, I talked about this yesterday. All of us are concerned about a new virus, how it affects us, and I think, you know, I said yesterday, I'll say it again. We are all in this together, and we were doing everything that we can to protect our healthcare workers. That's important, and we do have sufficient supplies of personal protective equipment. We do have those in place now, and we will ensure that we have everything that we need as we're going forward with this. I know it's a challenge, and I know many people are concerned. It's the unknown, and we're in that period of time where we're going to see people who were exposed a week, 2 weeks ago becoming ill, and we can't control that. What we can control is what happens from now forward. From when we started this, making sure that we are taking those measures everywhere. And our concerns with healthcare workers is that we're being exposed in the community. Not so much from people who've been in hospital necessarily, because we've only had very few cases in hospital, but we're also at risk in our own homes, in our communities, and that's another reason why it is so incredibly important that we take these social distancing measures, these physical distancing measures across the board in our communities. It protects our healthcare workers, it protects our health system, so that we're able to care for people safely in those environments. And it also protects our seniors and elders, which we know are the people who are more differentially affected if they do get sick with this virus.
James, go ahead.
I have a question for Minister Dix. So this morning, the Society of Notaries Public of BC has a press release which they're concerning the spread of coronavirus during the transaction of state conveyancing, and they asked the government to consider ordering a suspension of land title registry system for a short period of time. So what is your response to that?
I know a lot of this work we can do online. I haven't seen the letter, but as soon as I see the letter, we'll take it up.
Thank you. We'll go back to the phones. Questions from Moira, Graham, and Julian. Moira, go ahead, please.
Hi, Minister. Hi, Dr. Henry. We're hearing reports in Saskatchewan that doctors are being forced to self-isolate when patients show up unannounced with symptoms. Are we seeing the same problem? And, what's your advice for patients who are considering going to see a family doctor about potential symptoms?
Yeah, as we have said from the very beginning, the important thing is to call ahead so that people can be prepared. So you can call 811, you call your own clinician, and we now have assessment centers in a number of places around the province where people need to call ahead so that the appropriate precautions can be taken. And we know clinicians know how to do that. There's been challenges in some communities and across the province for community physicians in getting personal protective equipment sometimes. We're trying to address that as best we can. But clinicians here in BC, I can't speak to other provinces, but they are banding together to make sure we can do it in the safest way possible and that they can still provide those services to their patients. So there's a lot of virtual care going on right now in British Columbia, and that is one of the things that we've been able to get moving because of the concerns to be able to protect people so they don't have to go into a physician's office. So the advice really is call ahead.
Thank you. Graham?
Well, hi, Bongi. I saw Washington State, they're starting to report testing and testing capacity by facility, and they're ramping up testing. So can you just tell me when you say that there's 17,000 tests, are those completed? What is the backlog of test results, and what is your current capacity for testing?
Right. So, yeah, those are the completed tests. The data that I presented, and I talked about this earlier this week, we had challenges when we were expanding the testing to a number of different labs, and we had some challenges. There's a global challenge with certain reagents, some of the stuff that's needed to actually do the tests. So there was a backlog, and that is being worked through. It's in and that's one of the reasons why we've seen these peak in numbers this week. That's not a reflection of when people got sick. It's a reflection of when the test got reported. So, and we talked about this earlier this week as well. Even if the test is not back, people are being isolated, people are being put into self-isolation, or if they need treatment, are being hospitalized for this. But yes, I expect to have the backlog, I understand, will be completely completed by the end of this weekend, early next week. And we've brought online other laboratory capacity. I don't have the numbers in front of me at the moment, but we're in the several thousands per day. And I think it talks to the strategy that we had. So very early on, we were testing widely because we needed to determine where people were getting this disease and making sure that we were able to contain it as they came in. And that is reflected in the small blue boxes that went on for several months. Then we started to get a lot more sparks, if you will, primarily related to, in retrospect, related to travel and introductions from the United States. And we are very much at the mercy of the fact that we have a lot of close connections with Washington State in particular. So the testing strategy over the last 2 weeks has been to focus on where we make the most difference with our testing. If and when we flatten this curve, we'll be changing our testing strategy again. Because as we try and decrease the community transmission with all of those measures that we're doing today, including outbreak management, making sure we're protecting our seniors in long-term care homes, making sure we're detecting people in hospital or who might be going to hospital, making sure everybody who's traveled outside the country is self-isolating and looking after themselves. Once we get to the point where we've flattened the curve enough, then we need to start widely testing again to make sure that we're not getting more introductions. So that is down the road. Hopefully in a matter of weeks we'll get to that point. But right now the focus is on making sure that we are taking all of those measures to try and flatten that curve, bend that curve, so that we're not having people overwhelming our healthcare system and protecting our healthcare system.
Thank you. Julian, go ahead.
We're hearing from some people who are still on the job and are worried. So what can people do when their bosses or employers aren't doing enough to keep them safe?
Well, this is the challenge for us. We need to make sure that most people, if they're able, are able to work from home. If not, we need to ensure there are social distancing measures in place, which means minimizing the number of people that are in the environment, making sure we can do things virtually. Many different industries are less risky in that people are working outside where we know it's not transmitted as easily, but we still need to do everything we can to maintain those distances. And I know it's a challenging proposition for many industries, and we've been giving the guidance as best we can. When there's issues that have come up that we've realized are not, that are challenges for people, we've been ordering closures and alternative ways. But it is, I recognize it's a challenge, and we all need to work together on this.
Thank you. The next questions will be from Ashley, Craig, and Bethlehem. Ashley, go ahead, please. Ashley, CBC.
Oh, hi. Just curious as to, I know you've touched on this a little bit already, but why are construction sites still open and why are they being allowed to operate at this time?
Well, construction sites, some of these are essential projects that get things moving in our, I'm not, I can't go out and look at every single individual site. The expectation is that the industry will take this on, and we are working with WorkSafe BC as well to ensure that these types of measures are implemented across the board. So those are the venues that people can go to if they're concerned about unsafe work, as they have in other places. And some of these construction sites are taking the appropriate measures, and as they should be.
Thank you. Craig?
Yes, a question for Dr. Henry and Mr. Dix. Now that the border is finally closed to non-essential traffic, you called for it on Monday, happened at midnight Friday, Saturday. What type of monitoring or concerns do you have for the traffic that is getting through, the truck drivers and the essential traffic that is permitted?
So those are things that we've talked about for some days. So we know that there are essential workers that need to go back and forth. So what we've been putting the messages out, and we have an all of government response program now. So the messages that we give the direction, and then it is other ministries, other agencies that are working with the different sectors to make sure that the guidance is in there. And the same applies to industrial sites and construction sites and things. So our direction to the industries, like trucking, for example, is that they have active monitoring of everybody who is in that essential service to make sure that they can detect if anybody becomes ill. There's guidance about how they maintain their vehicles and cleanliness and hand hygiene and maintaining distance when they're picking up and offloading, etc. So those are the things that are really important. And when you do come back here, you stay in isolation at home. You keep that social distancing so that you're not out and about in the community here when you're going back and forth.
Yeah, just to say and to repeat, those workers and those truck drivers are in many cases essential services themselves, and so they need to follow the instructions and the recommendations of Dr. Henry, but it just shows that that various other people are required to ensure that our health systems and our social systems are maintained, that everybody else can pursue the social distancing and live in these very challenging conditions. We're obviously pleased that the federal government has shut the border to visitors. I think that's a necessary thing, and it's a particularly necessary thing in British Columbia, given the situation in Washington State, which has had an impact on us already, of course. And it's not that we don't have enormous support for people in Washington State. We do very much. We understand what everybody in public health is going through there and the extraordinary work that they're doing. But this was a necessary step, and we're pleased it's been taken.
Thank you. The next question is from Bethlehem. Bethlehem, go ahead, please.
Thank you. Hi, Dr. Bonnie Henry. I'm looking just for some clarity. Can you confirm that the 9th death that was announced yesterday evening was related to the Lynn Valley Care Home, and if it was a patient of the home or someone else?
My understanding it was, yes, a resident from the Lynn Valley Care Home.
Thank you. The next questions are going to be from Tiffany, Brenna, and Louise Dixon. Tiffany, go ahead, please.
Oh, hi, Dr. Henry. This is another question to do with the doctors. What we're hearing is that they're concerned that a lot of perhaps younger people that might not be watching the news or tuned into the news are not getting the message of social distancing. And they're wondering if the government can use the emergency texting system to remind them to stay home.
Yeah, that's one of the, I think that's a great idea, and that's one of the things that we're looking at, sending text messages or messages. We have been looking at how we can get those messages out on social media as well, where young people are more likely to be active on. Whether they sign up for these emergency notices, I don't know, but that's absolutely a channel that we're looking at, and we will be, I hope, within... It just came up, actually, to be honest, within the last 24 hours. So I said, yes, please, let's get our messages out there as soon as we can.
Thank you. Tiffany, go ahead. Next question from Brenna.
Actually, sorry, someone just covered it, so that's okay. Thank you.
All right, thank you. We'll now go to Louise Dixon.
Henry, there was a very disturbing article in the Globe and Mail yesterday, which was quoting the head of the ICU at Nanaimo Regional Hospital. He said he was very worried about the number of ventilators and he would have to choose which patients to save. So I'm wondering, do you agree with his comments, or are the hospitals on Vancouver Island prepared to deal with a number of sick people?
Yeah, you know what, I find that very upsetting as well, because we have a provincial strategy for ventilators. There are ventilators on Vancouver Island. We have other ones coming in, but no single physician will have to make those decisions in isolation. We have an ethical framework, and we have a provincial framework that supports how those decisions might be made if and when they were ever necessary. But all of our planning is to support each facility around the province to make sure that we can react to where people are and where people are needing care. So this is not something that an individual physician will have to do on their own. These are terribly distressing decisions, and I think it's a reflection of the concern and what we're seeing around the world that it puts us in moral distress. We talk about it in the ethical world, and we have a plan. We've been working on our ethical framework for this type of a situation for many years. We started it during the H1N1 pandemic, and thankfully didn't have to use some of those decision-making principles. We refined it and developed it during the Ebola response that thankfully we didn't have to use. And it is in place now in the province so that none of us individually have to make those really terrible decisions without having an ethical framework to support us in doing that. And I am hopeful with everything that we are doing, we will never come to that.
And just to say that that's why we've taken the very, very difficult decisions that Dr. Henry and the health system and others have taken in this week when we talked about the cancellation of elective surgery. That had enormous impact everywhere. It had enormous impact on Vancouver Island. Just to put it in context, against the pre-COVID-19 response occupancy, there's been a reduction, and it made 371 beds, acute care beds, have been made available on Vancouver Island, and the critical care bed occupancy rate on Vancouver Island is like the rest of the province. It's 60% right now, and the reason we made those changes, which are very challenging for doctors and all of the doctors and the surgeons and the operating room nurses and the staff and the medical office administrators in Vancouver Island and everywhere else in the province have been dealing with those. But that is why we are preparing, and it's why the steps, all of the steps we're asking people to take to stop the spread of COVID-19 require 100% support, because our ability, we are making significant changes in the healthcare system. We still have to take care of lots of people who are dealing with lots of other things and continue to make intervention in urgent matters. But the ability of us to maintain this and to respond to this will depend on our collective efforts, our 100% efforts to reduce the spread of COVID-19. And that responsibility is collective, and it's also individual on everybody out there on Vancouver Island and everywhere else.
We have time for a couple more questions. They will be from Donna Dixon, and we'll end with Mark. Donna, go ahead, please.
Yes, Dr. Henry, when you are advising people to stay home, I'm wondering what that means for those who have second homes in resort communities.
I'm not sure what you mean. If somebody has a private vehicle and wants to be in their second home versus their home here, that should be fine as long as they're not out and mingling with others.
Thank you.
Does that answer your question?
All right. Thank you, Dr. Henry. And we'll end up with Mark. Mark, Radio Canada.
Hi. Thanks, Dr. Henry, Minister Dix, for offering French comments. It's always useful for French-speaking Canadians in the country to be informed in their language. I just wanted to get maybe a French comment on the healthcare workers being infected with COVID-19, Minister Dix. And then could you speak to what's happening in downtown East Side, if there's any cases in the downtown East Side, and it was observed that some people are lining up for lunch, for example. They're not using that social distancing. So if you can offer a comment on that too.
Sure. I'll speak to the downtown East Side. There's a working group that has been active for some time now, led by Vancouver Coastal Health and the City of Vancouver, to ensure that we're doing everything we can to support people in the downtown East Side. And that there's a combination of things. It's important to be able to provide food for people who need it, who are in need there, and taking some of the measures that they can to enhance social distancing. It's a challenge, as we know. People have many needs in that community, and making sure those needs are met and we're not causing undue harm is a balancing. But there are plans as well, should somebody become sick with this, and making sure that we can assess and care for them safely and support the community as best we can. There are challenges, and I know they're working very hard on them.
Il faut protéger à fond la vie et la santé de ceux qui travaillent dans le secteur de santé, qui travaillent directement avec des gens. Ça, c'est très important au niveau d'hôpital et un peu partout, parce que les peurs de tout le monde sont les peurs de ceux qui vivent et qui travaillent dans le secteur de santé, qui ont donné leur vie, vraiment leur vie professionnelle et leur vie quotidienne à garder les soins des autres. Donc il y a une grande obligation, et c'est un défi, parce que des gens qui travaillent dans le secteur vivent dans la société, et c'est la raison pour laquelle il faut à 100% suivre des mesures qui ont été proposées par le Dr Henry, qui sont des obligations et qui sont de toute façon obligatoires, parce que je pense que surtout ce qui s'est passé à Lynn Valley et à d'autres endroits sont très importants. C'est pourquoi aujourd'hui on a annoncé encore des mesures, je pense 12 mesures, pour protéger ceux qui vivent et qui travaillent dans ce secteur, qui travaillent pour les gens de troisième âge qui vivent dans les centres de soins. Et ce sont des mesures très importantes mises en place à Vancouver Coastal et à d'autres endroits, parce que depuis quelque temps, à cause d'une certaine des changements qui ont été faits pendant des décennies, vraiment en Colombie-Britannique, des gens souvent doivent travailler dans plusieurs centres de soins et il faut changer cela pendant cette période. C'était pas une bonne chose avant et c'est une chose inacceptable actuellement et nous efforçons de le changer. Merci. Thank you very much. Thank you.
Thank you all for participating.